If you've ever had surgery, you know the recovery can be, well, it can be tough. And a huge piece of that puzzle is managing the pain afterward. But what if there was a simple trick to make that initial, really critical pain relief last for days longer? Well, let's dive into a recent study that might have found exactly that.
I mean, really think about that for a second. Instead of just a few days of relief from a nerve block, what if you could stretch that out for almost a week and a half? It's a question that doctors and definitely patients have been asking for a long time. And it turns out the answer might be surprisingly simple.
You know, for anesthesiologists, this is the name of the game. Managing pain after an operation is a constant puzzle. The big goal is always to keep you comfortable with the fewest side effects possible, especially trying to minimize the need for powerful drugs like opioids. And one of the best tools they have is something called a nerve block. A nerve block is a pretty cool idea. Basically, it's a super targeted injection that completely numbs the nerves coming from, say, your foot or your arm after surgery. It's kind of like flipping a light switch that just turns off the pain signals before they can even get to your brain. The only problem? Eventually, that switch flips back on. The question is, can we keep it off for longer?
So, researchers have been trying to figure this out for a while. Back in 2020, there was a study that tried adding a common steroid to the anesthetic mix to see if it would help. But the results were kind of murky. It was just too small of a study, or underpowered, as scientists say, to really give a clear yes or no answer. It left this big question mark just hanging there.
And that's where this new investigation comes in. Researchers decided to go back to that same idea, but do it right with a bigger, more powerful study. They wanted to know, could adding a common, inexpensive anti-inflammatory steroid be the secret ingredient they were looking for?
So the setup was pretty simple. They had two groups of patients. The first group got the standard stuff, a long-acting anesthetic called liposomal bupivacaine. The second group got that exact same anesthetic, but with one addition, a dose of dexamethasone. That's our secret ingredient. The whole study boiled down to one question. Would that one little change really make a difference?
So to figure this out, they got over 100 patients who were all having foot and ankle surgery. They were randomly assigned to either the standard group or the experimental group. And then, for the next 2 weeks, the medical team tracked everything. Their pain scores, what other medications they needed, any side effects, the whole shebang.
All right, so after all that data was collected, it was time for the moment of truth. Did adding that one little ingredient actually work? Let's unpack what they found.
This is the big question, right? After all that, did adding a simple steroid actually do anything meaningful? The answer was, well, a huge yes, a really big one.
The biggest, most important discovery was all about the main goal, making that nerve block last longer. And the difference they found wasn't just a little bit, it was significant.
Check this out. The standard group's pain relief lasted, on average, just over 5 days, which is pretty good. But the group that got the extra dexamethasone, theirs lasted almost 8 full days. That's more than 2.5 extra days of targeted pain relief, all from one single injection. That is a massive difference.
Now you might see this number and wonder what it means. Basically, that p-value tells us that the chance of this result being a random fluke is less than 1 in 1,000. In the world of science, that's as close to a slam dunk as you can get. It means we can be really confident that the secret ingredient was what caused this amazing effect.
Okay, so the block lasting longer is a huge win. But here's the next logical question. Did that actually translate into patients needing fewer other pain meds? Because that's another major goal here.
And yep, the results here were pretty great too. The group that got dexamethasone needed way less of another strong anti-inflammatory drug. What's also really interesting is that opioid use was super low for everyone, which is fantastic news in itself. It just goes to show how effective these modern nerve blocks are in general.
Of course, you always have to look at the side effects, and here the researchers found something pretty curious. Over 80% of the people in the experimental group reported some lingering altered sensation, like numbness or tingling, compared to only half of the people in the standard group.
So at first glance, you might think, oh, that sounds like a bad side effect. But hold on. The researchers had a totally different take on it. They think this altered sensation wasn't a problem at all. It was actually a sign that the nerve block was still active and doing its job. In other words, it was a sign of success, not a complication.
Okay, so let's zoom out and pull all of this together. What is the bottom line? What does all this research actually mean for someone recovering from surgery?
So the key takeaway here is pretty clear and pretty exciting. Just adding a simple, common steroid can make a nerve block last for days longer. This could mean a much smoother, more comfortable recovery for patients, and that extra comfort might mean needing fewer other pain meds. Now, of course, more research is always needed, but this is a really promising step forward.
It's still early, for sure, but this evidence is so strong, it really makes you wonder, right? Could this simple, inexpensive addition to a routine procedure actually become the new gold standard for how we manage pain after surgery? It's a question that could genuinely change the recovery experience for millions of people.